Simone, the University Clinical Educator is there to support both the students and the clinical educator during the placement. I wonder if you could start by telling us a little bit about the support you can provide for the clinical educator.
A key way that the clinical education coordinators can support in those early stages of placement planning is in the offering of workshops and education opportunities for clinical educators, usually prior to the placement starting. Those workshops typically cover aspects like giving feedback, managing challenging students, and some of those core themes that clinical educators are usually quite hungry for information on. During the placement, of course, we are also able to provide support in a number of ways. This can be over the phone or potentially face-to-face at a placement site visit. And it's typically around things like general discussion with the clinical educator about a student, and then unpacking that and pinpointing whether there are any concerns and what those concerns might be. Obviously delivering practical strategies on then how to work with a student if there are concerns. And really as well, a key role is the interpretation and the marking of an assessment document during that placement. Sometimes they can be a little bit ambiguous, or clinical educators might not be overly familiar with those. So that's another way that we can support the clinical educator.
So I wonder, Simone, if you could talk now about one of the more challenging issues that you're aware of arising in a clinical placement, and how you've successfully supported the clinical educator to deal with that issue.
A recurring theme that can sometimes crop up on health professional student placements is around the concept of clinical reasoning skills. Some students have difficulties with that, and I had a student recently that was having some difficulty with their clinical reasoning skills. They were on a paediatric placement, and when that situation arises, I really try and work with the clinical educator to unpack specific examples and the specific areas that clinical reasoning is falling down. This particular student was having difficulty with the official transcription and analysing of a speech data with a child. And so I worked with that clinical educator to provide mock case data for the student to practice with, suggested the student attend tutorials in the workplace on that topic, or if that wasn't possible, to speak with a key university contact to do some extra work. And then working with the clinical educators really to just unpack any other student issues. The outcome there was very successful, and the student within a couple of weeks had made significant gains and ultimately passed the placement.